I want healthy, viable, working staff members on my team. Shit, I'm saving the planet and the government so much more money, and I get faster care, which is preventive. Why the fuck would a government stop this type of service?
Yeah, you put it pretty bluntly.
Hi, I'm Karmali. Welcome to Karmali Exchange. Business owners need to help each other out. Keep on pushing to meet the needs of the customer or meet the needs of the business. This is an opportunity to talk to business owners from a business owner who's got a unique service offering, I would say, that really isn't out there in Canada as much as other parts of the world. You're paving the way. You're the pioneer, I'm going to call it. Bill, welcome to the show.
Thank you. That's very high praise anyways.
What is Rocket Doctor and what does the business do?
Yeah, so the way to think about us is we're like a Shopify for physicians, if folks are kind of aware of that company, whereby we empower doctors to build and scale our own independent practices, largely virtually, but in some cases a mix of in-person and virtual. And then we go a step beyond and we produce a marketplace where we can connect all of those doctors out to patients, largely who may not have a family doctor, or maybe in a rural or remote community, or in the United States on Medicaid is what we target there. And we sit in the middle building all the software and systems to power that practice of medicine and then connect the right patient to the right doctor to have optimal outcomes.
And so using your Shopify example, Shopify makes a percentage off of the sale of the product. And in this case, how does the revenue come in for Rocket Doctor? Is it from the doctor or does it come from the health insurance or does it come from the patient?
Yeah, we focus on charging the physician for using our services, basically.
Fantastic. Now, this industry has gone through a lot in the media, outside of the media, access to care, quality of care. And one way, in my opinion only, is that what Rocket Doctor is doing is giving an opportunity for access to care that generally isn't available. Now, in major cities across this country, you keep on hearing, I don't have a family doctor. I can't get in to see my family doctor. I have to wait weeks or maybe even months to see my family doctor. These are a whole bunch of issues that have come up. When you start looking at your business model, how your genesis was to the world that we live in today, what's been maybe two of the biggest changes that you've had to go through with this big adoption and all the issues that come up with healthcare?
I think that there is this often thought process that everybody holds the same level of information that we have when we sort of know about a topic. And so it's been really interesting and sort of frustrating for me because virtual care accounted for less than 1% of all of healthcare in Canada before the pandemic. Even in the United States, that's like 20 years ahead of us, it was less than 5% of all healthcare was done virtually.
Yeah.
And I used to joke at the beginning of Rocket Doctor that it took a global pandemic to pull medicine kicking and screaming out of the dark ages into the 21st century.
Yeah.
And to our credit, the healthcare system, I think, has, exponentially improved in technology, and I think is one of the earliest adopters of artificial intelligence now. But still, there is an enormous amount of the population, both doctors and patients, who A, don't know virtual care exists, B, still aren't totally convinced that it's safe, and C, really don't know how to use it. And so that's what I mean about this knowledge gap, which is it is safe, it does exist, and it's covered by your public health insurance in many cases, but that kind of sort of confusion around it and, being forced onto people in the way it was at the start of the pandemic has produced, turbulent episodes of going up and down and sort of confusion in that way. So I think that misinformation and sort of lack of clarity to the first point, and then, regulatory stuff that comes from that, I guess, would be the second point.
So how do you get the message out? So you are going through the journey similar to what your example Shopify had to, that, hey, you can buy this not only in a brick and mortar location, you can buy it online. This is similar in the journey in that sense, but Shopify spent a lot of money to advertise and promote themselves as the marketplace for that, sort of their competitor, Amazon, of course. How does Rocket Doctor educate, inform, and motivate individuals to literally stay on their seat, get online, or get on a phone and use your services?
Yeah, I mean, you opened the segment by talking about the challenges and access to care for people across the country. And so, what I don't think we have to educate people on is the difficulties in getting a doctor. Everybody is unfortunately like acutely aware of how hard it is to get a physician these days. And I think everybody wants to get a doctor more easily. So, and is searching to find a doctor more. So, the key thing really we have to do is get the public to be aware that this is a safe, effective thing that they can do, and then make sure it's something that's affordable and ideally covered by your public health insurance within the provinces that you can access it in that way. And then we're a two-sided marketplace, so then there's also the physicians, so we have to get the doctors confident and comfortable with it, and make sure that the technology and system that we're building supports physicians to practice medicine effectively, because we're all burnt out. Like, doctors are sort of tired after the pandemic and otherwise, and so are looking for alternative ways to improve the practice of medicine.
Bill, when I look at all the business owners that I speak to anecdotally, the data that I get from different levels of government and independent federations as well in this country, one of the key drivers for business owners is providing enough benefits and room for people to live their lives. Health is a big issue for individuals, it impacts businesses as well. I do not believe business owners, Bill, have the understanding of the service that you offer. Are you more involved with letting business owners know that Rocket Doctor's out there, and that that could be an add-on to benefits, maybe even a carrot or an ability to incent someone to become an employee of a company when they have these types of services? How does that work from a business world?
Yeah, no, we haven't necessarily gone out to speak with employers one on one about this kind of thing. We've really gone direct to consumers, so we've gone straight to the patients, straight to the physicians, and this kind of marketplace model. But yeah, I think, as you say, most people aren't necessarily aware that it's something that they can get into. I think also for us, how we've tried to kind of flip the paradigm in Canada, especially, is, and especially in provinces that have maintained full funding to virtual care, is that you actually can just get access to it using your health insurance. You don't need any sort of special employer benefits. You should sort of have an entitlement in many ways to healthcare services with your provincial health card. So, like in Alberta and BC, there is no charge to patients. You can just go to rocketdoctor.ca. You can get an appointment with the doctor. It's all covered by your health card. That's the way we've structured it.
So give me a couple of minutes here, Bill. Excuse me while I speak to you business owners out there. And I think you need to have the responsibility and the opportunity to educate your employees. First of all, many of you are providing benefits to your employees. Fantastic. Good on you. Fantastic work there. Here's the opportunity. Think about what your employee has to go through. They first realize they need the service of a doctor. They have to book an appointment. They got to take time either away from their personal life or their job to go handle that appointment and then come back. We're still in the let's drive to our doctor to make sure we get the care that we want. Insert a program that you can put in many provinces on the backs of the healthcare insurance program, like Rocket Doctor, and say, hey, we can make sure you have this service. We can provide a safe, special room where it's quiet, very private, so you can speak to a doctor in that area, and that gives the opportunity. I would strongly encourage that you get on board with this, because this is the wave of the future, and companies like Rocket Doctor are providing that service, and in many cases, without charge. So business owners, here's your warning, here's your opportunity, because if you don't provide that opportunity and my business does, guess where your best employees are coming? They're coming to my business. So get ready for that. We're going to be in competition for good talent. I have an edge up because I'm using Rocket Doctor and other companies like them. So let me go back to you, Bill. You mentioned about 2 provinces that are still on board providing no cost to the patient. On one province, Ontario, kind of changed the plans not too long ago, where they were not providing the same type of funding towards this type of service. Number one, why the fuck would a government stop this type of service?
Yeah, you put it pretty bluntly. It's a long, complex, I think, reason for why what happened, and I think a lot of it goes back to that beginning point about a misperception. I think a lot of what happened was an unintended consequence of the changes in billing in Ontario, because they wanted to try to have an impact for certain people that were maybe abusing codes or whatever, but then they kind of forgot, like, oh yeah, 20% of the population doesn't have a family doctor, and a large percent of the population has a family doctor but can't see them in a timely fashion through no fault of the family doctor. It's just a function of how busy things. And then the third group are the people who get an acute problem, can't see the family doctor that night or the following morning, and so go to an emergency department because they don't know, is it an emergency or not? And the provincial phone lines, often will, err on the side of caution and send you in because they're often staffed by an RN, not a physician who can build a doctor-patient relationship, order blood work, lab tests, imaging, whatever. So yeah, we've tried to communicate that, about how things, and I know that there's currently discussions happening in Ontario at the moment. I did want to add one piece to your point that I was thinking about for the employers, because the other component, we actually have partnerships with pharmacies, and so we realized there was an opportunity to partner with pharmacies to connect them more easily to physicians who could help when patients needed a variety of different things, particularly in rural communities or otherwise, or maybe harder to get a doctor. So we did build programs to partner with dedicated landing pages and websites that are customized and branded according to that pharmacy. And we have had some businesses that have asked for something similar. And then on top of that, we have, my background is in point of care diagnostics and technology. So we've created these virtual stations with a Bluetooth stethoscope, a digital otoscope, blood pressure, and created a virtual station that you can put in a room in the office, where if I want to look in your ear, you pop the thing in your ear. And we've found a Health Canada approved digital otoscope where I can see pictures of your inner ear. I could be in, wherever in a big urban center, you could be in a rural community or at the office, and I could tell you if you've got an ear infection or not. So that's kind of a neat opportunity as well.
This is what I think is huge. Now, let's talk about going back to the government situation there. And here's a point I'd like to get your opinion on. In one breath, they're saying we got to make some cuts because there's been some abuse of the system. So we're going to go to the lowest common denominator and go how it used to be. You go to the doctor's office. That's what they're basically incenting based on the funding. They're going to cut the cost or the amount of funding to the doctor because they're trying to cut the cheating of the system. On the other side, the same government is talking about how they want to reduce their carbon footprint. So they're saying, get into your car, go to your doctor so that every funding can be paid, but increase the carbon footprint. And I don't know, in cities like Toronto, what the heck are you be doing here when we're doing all this type of stuff? I don't understand why governments would talk out of both sides of their mouth when they're trying to achieve the same goal. Keeping people in place for care reduces their carbon footprint. And if you think about all the work, now you add on the technology you're doing, Bill, and you go in the office and I can put virtual Bluetooth, all this type of technology in front of me. Shit, I'm saving the planet and the government so much more money, and I get faster care, which is preventive. What the hell's wrong with that? Why do you think the government would still do this type of stuff?
Well, you framed it in a way that makes sense. I would say that I think, look, the government has ultimately a difficult job to balance the whole budget of the province and everything else. But yeah, there is no reason why this should not be fully funded, and why you shouldn't be able to get access to a physician through a virtual ecosystem. Because yeah, and I have argued that exact point, which is, yeah, it's hugely beneficial to the environment. There's no reason why you need to drive, and it sucks as a patient. Like, why do you want to? And the thing to conceptualize also is, as doctors, we, for many generations since the beginning of time, have basically said to patients, okay, humble yourself before me, come to my office and sit and wait for me. But now virtual care actually flips that whole paradigm. So there's a lot of discussion about, well, is the relationship is good and X, Y, Z. And it's like, does any person really want to sit in this awful office in a crowded waiting room so you can get into this sort of uncomfortable thing with the paper charts and the paper thing on top of the bed? And like, you don't gain anything from that necessarily as a doctor, really. And I hear, oh, you have to do a face-to-face visit. It's like, you are doing like we're doing face-to-face right now. I can see you. And when I do a virtual visit, I can see into the patient's home often, so I get to understand how you live. It's not just you coming to me to my office in this kind of sterile environment. So yeah, there's a lot of intangible benefits to virtual care that we've not yet, I think, fully realized, also because it's so new generally.
From a consumer perspective or a citizen of the province, I find it very interesting that the Ontario government is looking for ways to have the consumer have access to beer and wine more conveniently than they are care from their family physician in a more convenient way. I just find it very interesting in that perspective. It's just a different world. I live in a different province than Ontario. I know I'm knocking on them because they're the topic du jour. It's not like my province has done fantastic work overall, but in Alberta, we look at to make things easier, simple, faster. Generally speaking, that's just been our piece. And I'm not saying it's perfect. There's a lot of work we got to do here. I'm just surprised that it's easier to get a bottle of wine or a bottle of beer than it is to access your doctor. That's the society we live in at this point in time.
Yeah, I mean, I will say it is great that in Alberta it is fully funded, and so there are ways to improve the system definitely, but like a physician who sees patients virtually on evenings or weekends or statutory holidays, you don't get to bill extra for that. Although who would ever want to work on those holidays? Doctors do it on the platform, even though they're not paid any differently. So I think that's an opportunity to get more doctors into the system on those kind of unsociable hours when most people want to be with their families or on vacation, not working.
So what do you think what you're experiencing from province to province that we're heading our way to a private healthcare system, or is it still going to be publicly funded?
Well, I mean, no. So, like with Rocket Doctor, for example, we are a Canadian technology company that builds solutions to empower doctors practicing medicine on the public sector. And so, when you think about it, it's like as a physician, I'll go buy my stethoscope from Littman Cardiology. I'll go buy an typically we'll buy a computer from whatever private company. This is how, societies work is you create industry and companies and then those things help. So this is the same idea as Rocket Doctors. We're creating a technology company with software to help empower physicians to better practice medicine. Ideally, if, government's fully funded, then you can build that on the public healthcare. And so we're actually finding a way to make the public healthcare system much more efficient and effective. In a traditional way it works today, like doctors pay for electronic medical records today that run their practice. You wouldn't expect the government to produce a single, system necessarily that, you might turn that to a tech company to do. So that's the idea. And we're trying to do that as a Canadian technology company.
Bill, do you think with the way that technology is going, that other individual businesses, let's pick on the insurance companies, will start stepping in and saying, we see value in what Rocket Doctor's offering. Why don't we use Rocket Doctor services or supplement the gap between what the government's providing and what the doctor should get paid on the backs of a health spending account or a benefit package? Do you see insurance companies kicking in?
Yeah, I mean, some do already with some of their packages in sort of a more HR employer benefit kind of B2B deals. What's interesting is there are things that are not covered by the provincial health insurance, like definitively aren't covered, and so that's opportunities to engage more with the larger private insurance companies as well to cover those sorts of things, like for example remote patient monitoring, those devices. Often mental health or physiotherapy, those things aren't covered. Yeah, I think so. Is the answer.
And so when you look at all these in front of you, what further opportunities for Rocket Doctor do you see, and how can you expand all that great success that you've been having already?
I mean, when you think about it, only currently like 0.15% of all of the market, like we have 99.75% or 985% of the market available to us because it's so massive in terms of all the healthcare people need. So honestly, it's just, I think, a function of getting more people to be aware of what we're doing and to be using and engaging with the system is the primary objective right now.
When we first spoke and I heard your story a while ago, I made a commitment to you that I want to bring you on this show to share your story with business owners so they can learn about how they can adapt and how you have been so dynamic in your business. But I also made the commitment to you that I want to share your story with as many people so they can jump on board. I think this is the wave of the future. I think it is very slow in its uptake right now. And I think as business owners, we have as much responsibility as the government does to let the people know, because I want healthy, viable, working staff members on my team. This is one mechanism that will help. And I hope all business owners that watch and learn from you are going to take on the same mission that I have. And I've been yelling rocket doctor to all my staff members for a long time now, and I hope they do the same thing. Bill, if there's one piece of advice you would give business owners in dealing with such dynamic stuff, think about you're dealing with business owners such as doctors, you're dealing with government BS and regulation, you're dealing with patient demands and how it changes. What advice would you give to business owners today?
Persistence, I suppose, and calm in the storm. Maybe. I mean, you just. I think you just have to kind of assume that something is going to go wrong that you can't predict, and then be comfortable with that assumption. And then when something does go wrong that you hadn't predicted, just sort of go through it step by step, and all you can do is basically work towards a solution, essentially. I don't know, and then be persistent, because everybody will say like, oh, that's a dumb idea, or oh, that's not going to work, or oh, this isn't good. But you just have to keep doing it, because eventually, if it's the right move, everybody will eventually go, oh yeah, actually I think that's okay. Okay, fine.
The recipe to a successful business and a successful business owner, it is the persistency to pursue the results you're looking for. There's always a solution. And Bill, I want to thank you for all the work you're doing for this country. I don't think patients really appreciate what you do. I think they need to, and I think business owners need to jump on board. So Bill, thank you for joining us today.
Thanks, I appreciate it.
Thank you for watching the Karmali Exchange. Make sure you subscribe and hit the notification bell so you never miss an episode. You can also follow me on social media at Faisal Karmali, where we can continue the business conversation.